Hello, my name is Dr. Dewan S. Raja. Today I will discuss about ankylosing spondylitis. Ankylosing spondylitis is a type of chronic inflammatory arthritis that primarily affects the spine and sacroiliac joints, and these are usually symmetrical. Over time, this condition can lead to fusion of vertebra, resulting in reduced range of motion and a characteristic forward stooped posture. It may be associated with uveitis and aortic regurgitation. Uveitis means inflammation of the uveal tract, that is the iris, choroid, and the ciliary body of the eye. More common in males with age of onset, usually 20 to 40 years, but it may start during adolescent period. The condition tends to progress slowly over time with alternating periods of flare-ups and remission. What are the symptoms of ankylosing spondylitis? Lower back pain and stiffness, particularly in the morning or after periods of inactivity, stooping forward with hunchback posture, pain and stiffness in the hips, shoulder and other joints, fatigue, and a general feeling of discomfort. The ribs are affected, particularly costochondral or sternochondral joints. Also, the joint between the transverse process and head of the rib, transverse process of the thoracic vertebra, and the head of the rib and the tubercle of the rib may also be involved. So that may lead to difficulty in breathing. Chest do not expand properly. In severe cases, inflammation can affect other parts of the body, including iritis or uveitis, heart, and lungs. So posture is the here in this person, he may be kyphotic in the upper part of the vertebral column, stooping forward, but they lose their lumbar curvature also. What are the causes and risk factors? Genetic factor, the HLA-B27 gene is strongly associated with ankylosing spondylitis, but not everyone who carries the gene will develop the disease. Family history, if a close relative has ankylosing spondylitis, you are at a higher risk. Diagnosis, physical examination, assessing flexibility, pain level, and range of motion. Imaging studies like X-rays, MRI, and CT scan are used to detect changes in the spine and joints. Blood tests check for inflammation markers or the presence of HLA-B27 gene. Okay, this is the X-ray. Here we are seeing the lumbar vertebra, sacroiliac joint, lumbar vertebra intervertebral disc has been fused, and we are seeing bamboo spine appearance. Sacroiliac joint is almost obscured due to the fusion. Okay, so producing appearance similar to stick of a bamboo. There's difficulty to see the sacroiliac joint because of fusion. Okay, so we got this bamboo spine appearance here, here. So what is the treatment of ankylosing spondylitis? What is the treatment? Treatment is symptomatic mostly. Medication, non-steroidal anti-inflammatory drugs, NSAIDs, are commonly used to reduce pain and inflammation. In more severe cases, biologic drugs such as TNF inhibitor, TNF means tumor necrotic factor inhibitor, or disease modifying anti-rheumatic drug, DMARD, might be prescribed. Physical therapy, regular exercise, and stretching are crucial to, to maintaining posture, flexibility, and mobility. So you need physical therapy. Okay. Lifestyle modification, staying active, maintaining good posture, and quitting smoking can help manage symptoms. Surgery rarely required but may be considered in cases of severe joint damage or spinal deformities. Okay, so the now we'll go to the complications of ankylosing spondylitis. Complications happen if it is untreated or poorly managed. Ankylosing spondylitis can lead to complications like ankylosis, fusion of the vertebra, leading to a loss of spinal flexibility, reduced lung capacity due to stiffness in the rib cage or spine, eye inflammation, a painful condition that can affect vision, cardiovascular tissue, and increased risk of heart disease in some patients. Heart disease chance is more like that of aortic stenosis. There may be pericarditis. There may be AV bundle block. Okay, so we may have more chance to have heart failure. And that's all about the ankylosing spondylitis. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.